friends, I'm Dr. Molly Brinkman. I'm a small animal veterinarian near Nashville, Tennessee, and this is a show for people who love their pets, they like to laugh, and they realize that life is hard, but dogs and cats help. I love veterinary medicine. I'm probably already obsessed with your pet, and I want you to understand more about both of those things. Welcome to the Dr. Molly Says podcast. Hello, friends. I have to be honest with you and tell you that I am recording this episode for the second time because the first time I recorded it, I thought I set it up right, and I was very wrong. So I talked for a long time about our topic and got done, thought it was great. That's a wrap, and it didn't record right. So we're doing this a second time, but it's okay. That's just kind of how this week has gone. I'm in the barn like I am every week, and it's April almost, and it's supposed to be warm, but it's not. It's 44 degrees. So we're cozied up on the chairs with a blanket and my Dr. Molly Says mug, and we have some fun things to talk about. But first, we're going to do our hot takes, and I do have a hot take for you. This is a hot take for pet owners who may find themselves in the emergency room with their dog or their cat or their hamster, their bird, whatever pet you have at the ER. If that happens to you, please, I know it's stressful. You probably, the next day, you're tired. You spent a lot of money at the ER probably. You're worried about your pet. Hopefully they're okay and they came home with you. But something to remember is that although the ER or the urgent vet or the vet you don't normally see should eventually send records to your normal GP vet. That doesn't always happen, and it can be for different reasons. Sometimes they get the wrong name, they get the wrong vet, they send records to the wrong vet. Sometimes you just don't ever get records. But it's very important that we, your GP vet, get those records for a number of reasons. I've had a few cases lately where that hasn't happened for one reason or another, and it was nobody's real fault except those patients really needed more follow-up than they got, and we didn't know they had been at the ER. So just something to think about. This is the hot take. If you go to the ER with your pet, if you think about it, call your vet the next day and just say, hey, we were in the ER. Send them an email even. Just want to make sure y'all got the records. Let me know if we need to do any follow-up because we don't want to miss any important follow-up. Okay, that's my hot take. There's a lot going on in life right now. I'm a GP vet here near Nashville in a town called Franklin. If you don't know me yet, I'm a mom. I've got 2 little kiddos. And so my husband Ryan and I are always super busy with the kids. Spring is always busy. There's a lot going on right now. And I have been busy with some organizations I'm involved in. I've got a really exciting week coming up. There's just a lot going on. But I'm very excited about this podcast episode. So this is the first of hopefully many episodes where it's just you and me chatting. And we're going to talk about a very kind of medical topic, but we're going to talk about it in a way that you, just pet owner who maybe has no medical background, can understand. And the reason I was so excited to do these episodes when I started the podcast is because I know that veterinarians are so busy, right? Your vet is overwhelmed, most likely. In any given day, they're seeing 20 to 40 patients. They're stressed and they're busy. And, dogs and cats and horses and cows and all animals can get really complicated diseases. And your vet has to juggle a lot of different types of illnesses. And sometimes we only have, 20 minutes, 15 minutes in the exam room with you. And so it can be hard for vets to really be able to explain disease processes to pet owners. And I understand that struggle because sometimes you just literally don't have time. And I'm sure a lot of vets out there feel the same way I do, that that's a hard part of the job, because for me, I really want to just sit in the floor and chat with a pet owner and explain to them exactly how whatever disease we're talking about works. I want to tell them what's cool about that disease. I want them to understand some of the actual medicine, but that's not realistic in a lot of vet situations. So I want to do it for your vet. I want to explain something very complicated to you in a way that makes sense because I firmly believe that pet owners, educated pet owners, make the best pet owners. Because if you can understand what's actually going on with your pet, then you can anticipate what your vet might recommend. You can ask good questions. You can feel more confident about what your vet recommends. And everybody wins, most importantly, your pet, because they're going to get better treatment if you understand what we're doing and why, and you're on board with it. So that's why we're doing this. So that leads me to the next section of our podcast. It is called The Twilight Bark, and the topic for this week's episode is Addisons. So we're going to do a little series of this week and next week on adrenal gland disease. So this week we're going to talk about Addisons. Next week, we're going to talk about Cushing's. And these are two diseases that are sort of opposite problems with the same organ, and that's the adrenal gland. And if you've never heard of an adrenal gland, don't worry. That's okay. A lot of people don't know what the heck that is. I'm going to tell you. So dogs have two adrenal glands, and they're these small pieces of tissue that kind of piggyback next to the kidney. So your dog has two kidneys, one sort of on each side of their abdomen, and then they have two adrenal glands, and they kind of sit close to the kidney. And the adrenal glands are part of the endocrine system. So they have to do with hormones and hormone regulation, and they are responsible for different things. But adrenal glands are cool. So they're this organ that has different sections of tissue, and each zone of tissue is responsible for secreting a different hormone. And diseases can arise when those adrenal glands don't produce enough of one or more hormones or are producing too much of a hormone for different reasons. And Addison's is the name for the technical disease called hypoadrenocorticism. That's why we call it Addison's, because it's a mouthful. But hypoadrenocorticism, or Addison's, is a condition where the adrenal gland does not produce enough stress hormone, cortisol, or another hormone called aldosterone, or both of them, actually. And those two hormones cortisol is called the stress hormone, and they're responsible for different things, but they are extremely important for a lot of bodily functions. And we categorize those. Each of those hormones, so cortisol and aldosterone, are part of two different categories. Glucocorticoids are what cortisol is, and mineralocorticoid is what aldosterone is. We're in the weeds already. I need you to bear with me. I know this sounds really complicated, but it's important that we set the play up right, okay? So you need to understand, adrenal gland has different zones. One zone secretes glucocorticoids, and that's what cortisol is. Another zone is responsible for mineralocorticoids, which is what aldosterone is, okay? And so those are the two hormones we're going to talk about when we talk about Addison's, cortisol and aldosterone. Like I said, they're very important hormones. They're responsible for very important functions in the body. We'll talk about cortisol first. So we call cortisol the stress hormone because cortisol really is important for life, because cortisol is what is released and regulated by the adrenal gland in response to different stressors in the body. So cortisol helps regulate metabolism. It helps regulate blood pressure. That's a really important function. It has to do with hydration and just compensation for stress in the body. So when dogs have physical or emotional stress, their cortisol levels go up, and that's how they compensate on a physiologic level. Aldosterone has a couple different roles, but the main thing we think about in medicine when we talk about aldosterone is electrolytes. So aldosterone is part of a complicated system, but it has to do with the kidneys. It regulates the kidneys' excretion and resorption of potassium and sodium and other things. But those are the two electrolytes that are important when we talk about Addison's. So aldosterone makes sure that potassium and sodium are regulated through the kidneys. So the kidneys, they're a very cool organ. We'll talk about them more later, but they control how much potassium gets kept in the bloodstream and the same for sodium. So those are the two hormones that when a dog has Addisons are too low, okay? And that's what Addison's is. A dog doesn't have enough of those hormones. This is a disease in dogs. Humans can get Addisons, but we see this mostly in dogs. And this decreased level of cortisol and aldosterone can lead to major illness and eventually catastrophic illness that can very easily lead to death. So we're going to talk about more details about that. So something to know about Addison's is it's pretty rare. Some of you probably have had a dog with Addison's. Some of you know someone that's had a dog with Addison's. Some of you might be humans with Addison's. And it happens, but it's rare. It's not super common. It's a disease. It's a very cool disease. We call it the Great Pretender. I'm going to explain to you why. But in vet school, Addison's is kind of like this mythical thing that we talk about. And our professors are kind of like, when you get out into practice, if you're going to be in medicine, GP medicine especially, you're going to have an Addison's case sometime in the first couple of years, probably. And it's going to be very cool because it's going to hit you like lightning. This is my Addison's case. I remember my first case of Addison's. If we have time, I'll tell you about it. So it's rare, but it happens. And it's most likely to be found in young to middle-aged dogs. So we don't fully understand the way Addison's happens or why dogs have Addison's. We do know there is a genetic component, at least in some breeds. And we think what happens is the immune system actually attacks the adrenal gland and those zones of the adrenal gland that produce those hormones. And so it's an immune-mediated process that happens over time. And so that's why usually we're going to diagnose this, like I said, younger, but middle-aged dogs. And actually female dogs have Addison's more than male dogs. There are some breeds who are more predisposed to developing Addison's, and standard poodles are the poster children of Addison's. Now, I don't know if you know this, but there are a lot of dogs who are mixed with poodles. The doodles, the oodly doodly, schnoodly, Aussie, Bernedoodle, doodles. And, Addison's is rare, but I would say there may be a paper about this. I would say it's becoming more common because there's poodle in dogs everywhere. But poodles, they're the poster children for it. Westies are a breed that are predisposed. Great Danes, if you didn't know, Portuguese water dogs and Labrador retrievers actually can have Addison's more than a lot of other breeds. So there are more on that list, but those are kind of the ones we think of. So it's important to know if the breed your dog is predisposed to Addison's, you're going to want to listen up and be aware of these things. So like I said, Addison's happens over time, usually in these typical cases where it's kind of an immune-mediated process. What these patients look like, I'm going to tell you how we diagnose it. But the clinical signs, what you would be looking for to kind of think about, does my dog have Addison's? They're very vague, actually, which is what makes Addison's so difficult for veterinarians to diagnose sometimes. So a lot of Addison's patients, in hindsight, we look back over the last couple of years and we think, okay, yeah, like this timeline of things kind of makes sense in hindsight, but that's always 2020, right? At the time, these dogs can have sort of waxing and waning, very general vague signs. So a lot of these dogs will have GI symptoms, so episodes of vomiting and diarrhea. Now, we all know that lots and lots of dogs have vomiting and diarrhea for a lot of reasons. So don't call your vet tomorrow if your dog has vomiting and diarrhea and tell them Dr. Molly thinks your dog has Addison's. But that is one thing that they can do. These dogs can have decreased appetites. They can just kind of seem off at times. Sometimes this can be related to stressful events. It usually is sort of this off and on chronic thing. If it goes on for long enough, the symptoms can get worse. Some of these dogs will drink and pee more than normal. They'll start to drink and pee more. They can lose weight. They can be dehydrated and get weak. So the scary thing about a dog with Addison's that's not diagnosed and not being treated is what can happen when those levels get low enough and things get out of whack enough. They can go into what's called Addisonian crisis. And Addisonian crisis is a very dangerous, very potentially fatal issue. So dogs in crisis, they finally sort of tip over the edge with their symptoms and their levels, and they get really sick. They do often have GI symptoms. They may vomit, they may have diarrhea, but they get very weak. They can be basically obtunded. So they're laying laterally. They may be breathing hard. They may be unconscious and just really sick. They have really low blood pressure. They're shocky. They can have low blood sugar. And in a lot of cases, because their aldosterone levels are so low, and remember, aldosterone controls potassium and sodium, their potassium levels can get really high. And that's really dangerous. It can cause dangerous arrhythmias and a lot of problems. Dogs often die just because their potassium levels get so high. So these dogs usually get taken to the emergency room or rushed into a vet's office because suddenly they're very, very ill. When a veterinarian is looking at a dog, they think it might be an Addisonian crisis. They're going to see these symptoms. Suddenly they're very weak and sick and low blood pressure and all these things. They're going to run blood work. One big tip-off in a crisis situation is those electrolyte imbalances, so high potassium, low sodium. That doesn't always happen, which we'll talk about later. But typical Addison dogs, they're going to have electrolyte abnormalities on their blood work. They do often have low blood sugar. Their blood pressure is really low. So anytime in a crisis situation, a vet suspects this dog could have Addison's, they're probably going to run some type of blood work to try to diagnose Addison's because we want to be sure about that when we treat it. We're going to treat a dog that we think is in crisis for what's in front of us, for the symptoms that they have. We're going to correct their blood pressure, give them fluids, give them meds to lower their potassium, whatever we need to do to keep them alive. But ideally, a vet will be tipped off, this may be Addison's. They're going to draw blood for what's called a baseline cortisol. And that's a quantitative measurement of cortisol levels in the blood. And this is a really important thing to understand. So baseline cortisol is just a random drawing of blood and measurement of cortisol. In a normal dog, that cortisol level is going to be over 2. And anytime we run a baseline cortisol, and that value is under 2, we worry about Addison's. So in a crisis situation, we're going to run a baseline cortisol a lot of the time. If it's Addison's, that's going to be low. And then we're going to do another test to confirm whether or not they have Addison's. And I'll explain that test to you in a minute. It's called an ACTH stimulation test. But dogs in Addisonian crisis, like I said, if you've ever been in that situation, you know it's extremely scary. People in the ER or your vet's office are going to swarm to your dog, vets and techs and assistants, and they're going to all hands on deck, treat your dog. They can definitely save your dog's life when they treat them effectively and quickly, but it really is a life or death situation. So that's the worst case scenario in dogs with Addison's. We haven't diagnosed it. It's been sneaky, which Addison's always is. And now they're in crisis. We just have to keep them alive, get them stable. Once we diagnose Addison's, we've tested, we know that's what this is. Those dogs are going to get some steroids. They're probably going to get some IV steroids, help stabilize things. They're probably going to go home on some oral steroids, and we're going to initiate treatment with an injection that I'm about to tell you about. So one thing to talk about is when we diagnose Addison's, there are a lot of changes that we can see on the blood work. Some of them are very subtle. I told you the electrolyte imbalances are kind of like the big tip-off, but we can see other things. Low blood glucose was one of those. Some of these dogs look like they have kidney disease, so their kidney values will be high. And there's some other subtle things that I'll tell you that we see when we see a well patient that's not in crisis that we think might have Addison's. So Addisonian crisis, it's very scary. We stabilize them. We start long-term treatment for Addison's. Now let's talk about dogs that get diagnosed with Addison's that don't go into crisis, which is obviously a better situation. We do diagnose Addison's sometimes in patients who are not in crisis, who do have those more vague symptoms I told you about, waxing and waning illness, general vague things. Your very smart vet is going to start going, I wonder if this could be Addison's. Because truly, we're always wanting to diagnose a dog with Addison's. So a lot of times we'll get tipped off for this from changes on blood work, like I was telling you. So one interesting thing that I hope you find interesting is, besides the other blood work findings I told you about, we'll see those subtly on blood work in a patient that's not in crisis that has Addison's. The electrolyte abnormalities are a big one. But something else we will see, and this is often something, again, like a hindsight when we look back at blood work we run when those dogs have had this kind of subtle illness, is in normal dogs who have appropriate amounts of cortisol, when their body is stressed for one reason or another, there's something that they do where they increase their one type of white blood cell in their bloodstream called neutrophils, and they decrease another type of white blood cell called lymphocytes. And we see that when we run a blood cell count on your dog, when we run blood work. On the CBC, we call this a stress leukogram. I know we're in the weeds a little bit, but stay with me here because this is cool and important. So a stress leukogram is a sign that the body is reacting to some type of stressor. So we'll see higher than normal neutrophils, lower than normal lymphocytes. And in dogs that have Addison's, if you look at their blood cell counts, they often don't have a stress leukogram when it would make sense for them to. So I often will start thinking Addison's if I see a dog who's got repeat episodes of GI upset, vomiting, diarrhea, that maybe doesn't respond to treatment like a typical dog, kind of lasts longer than it should, kind of gets sicker than I would expect them to. I always want to see, do they have a stress leukogram if we run blood work and look at a CBC? So those are sort of things that can tip us off that a dog might have Addison's. It often takes a while to get to even a suspicion of Addison's. That's something I think it's important to understand, that, Addison's, we call it the great pretender because it can look like kidney disease. It can look like the 500 other GI diseases that your poodle mix is prone to. It can look like nothing. And so Addison's is difficult. It's difficult to kind of get to that diagnosis sometimes, especially in dogs, like I said, that have this sort of chronic low-grade illness. So going back to, remember how I told you we tried to diagnose Addison's. So if we see a patient, if I'm suspicious that my patient may have Addison's, I'm going to recommend that we run that baseline cortisol that I told you about. And I explained to my owners, hey, this is a rare diagnosis, but it's an important one because we don't want to miss it and then your dog go into crisis. So I'm going to run a baseline cortisol. And if your dog's cortisol is greater than 2, then we are very positive that your dog doesn't have Addison's. We can move on from that theory and think about other differentials for their sickness. If we run that baseline cortisol and that level is less than 2, that tells us that dog could have Addison's, but it's not how we diagnose it. So it's kind of a screening. If it's less than 2, but it's not less than 1, that's kind of the gray zone. So if the cortisol is 1 to 2, it makes us go, it could be Addison's, but it's low enough that we should test to be sure. If it's less than 1 or even less than 0.5, then we're really thinking, ooh, this could be Addison's, and we might be getting very excited. So we run a baseline cortisol. If it's lower than 2, then that would warrant us running what's called the ACTH stimulation test that I mentioned earlier. That is a test where we get the baseline cortisol, that's a blood draw. Then we give your dog an injection of a medication called Cortisol, and this stimulates the adrenal glands. And when we give Cortisol, we have an objective measurement that it should raise that cortisol level by a certain amount. So we give the injection of Cortisol, we draw blood in an hour, and we remeasure that cortisol level. And in a normal dog, we should see that cortisol level go up, okay? It was stimulated, so the cortisol goes up. In Addisonian patients, they're not going to stim, so that cortisol level doesn't go up appropriately. And there are objective measurements, levels that tell us this is Addison's. And so that's how we diagnose it. So that's how we confirm that's what's going on. And then we can move on from there and treat Addison's the way we want to treat it. So in these patients that are not in crisis, we determine they have Addison's. We initiate treatment. And it's the same thing we do in our crisis patients once we get them stable. In our crisis patients, they're probably going to go home on oral steroids, often prednisone, and we're going to start that at higher doses than what we do often with patients who aren't so sick when we find Addison's. So whatever dose we start them on prednisone, that is a glucocorticoid. That's what prednisone is. So it's replacing what we don't have from cortisol, okay? And so we start on a certain dose of pred. That's going to be a little bit different based on the situation. And we're going to taper that dose of prednisone down. So we're going to lower the dose and get to what we call a physiologic dose of steroid, of prednisone. And that dose, we hope, is small enough that it doesn't cause major steroid side effects, but it's enough to keep all those functions that cortisol is responsible for intact and keep our dog healthy and feeling good. So that's the goal with glucocorticoid cortisol basically replacement. We use steroids, we taper them down to a really low dose. In a typical Addison's dog, remember, they're also deficient in aldosterone, and that's what's majorly responsible for those potassium and sodium levels. And that's a mineralocorticoid, and so we also want to replace that. And we have a way to do that with an injection, and we call it DOCP. And I'm going to tell you what it stands for, but I'm going to look at it on my paper because I'm very bad at saying these words. It's desoxycorticosterone pivalate. And that's why we call it DOCP. The brand name for that injection is, there's Percortin and Zycortal. So those are injections that we will give your dog every 25 to 28 days. That gets adjusted a little bit based on your dog's response. But it's an injection we often give in the muscle. In some cases, we can give it just under the skin. But it's given to replace that mineralocorticoid. When we first start treating Addison's, we're usually going to give a DOCP injection, start the steroid, and we're going to monitor your dog's electrolytes every couple of weeks at first, at like 2 and 3 weeks. And then from there, depending on what they look like, we want to make sure that those potassium and sodium levels go back to normal or as close to normal as possible. We also want to make sure your dog feels better, and we want to make sure they're doing okay on those medications. So that's the kind of long game with Addison's treatment. We want to replace glucocorticoids, prednisone, and mineralocorticoids with DOCP. I think it's important for people to know that Addison's feels like a really big deal when we diagnose it. And it is, because it can be life-threatening. But dogs that are that handle those treatments well, that are treated appropriately, they do well on those medications, they can live normal lives. They do quite well. One thing that's very important with Addison's treatment is something I try to educate pet owners about a lot, is that because these dogs can't compensate for stress the way a normal dog does, sometimes we have to increase their steroid dose, their prednisone dose. So these dogs, if they're going to travel or be boarded or they get sick with something else or come to the vet, anything that happens that's stressful, your vet should advise you on increasing the prednisone dose for that day or few days. So don't forget that. And if for some reason your vet didn't talk to you about that, or you just forgot, because I know it's a lot to talk about, don't forget that. You're going to need to increase their daily prednisone dose sometimes for stressful things. So I am trying to stick to my outline because I could just ramble about this all day. Remember, Addison's is rare, okay? In most cases, it's not Addison's, but it can be Addison's. So I think it's great for you to really understand what it is, what it can look like, and something that we, your vet, and you, the pet owner, can think about. If you have a dog who is a predisposed breed, if you have a Great Dane, a Portuguese water dog, a poodle mix, something to be aware of, your dog is more likely to have it. It's very sneaky. It can trick your vet, and sometimes it takes multiple tests to rule out other things to get to a high suspicion of Addison's. So just know that that's normal, and your vet is doing their due diligence, and it's typical for it to take some time to get there. You can't, and again, I'm just going to reiterate, you can get to a normal life with your dog after an Addison's diagnosis. So I hope that's encouraging because, like I said, it feels very scary. The other big thing I wanted to talk about, because we just kind of covered a lot. I hope you're still with me and find this interesting, but what I just talked to you about was typical Addisons. So Addisons can have cases, or Addison dogs can be what we call atypical. So we have cases that we call atypical Addisonians. And these are dogs who have signs of Addison's. They may go into Addisonian crisis, but they don't have the typical electrolyte abnormalities, because that's sort of our kind of big like hallmark sign of Addison's. So we can diagnose dogs with Addison's without electrolyte imbalances. And the reason that happens is because in some dogs, for some reason or another, that immune-mediated process that affects their adrenal glands doesn't affect the part of their adrenal gland that produces aldosterone as much. And so their aldosterone levels are not as low as their cortisol levels, and so their electrolytes are okay. And so these dogs can still go into crisis. It's sometimes not as severe because they don't have really high potassium levels. So these dogs can actually sometimes be treated with just glucocorticoids, so just the prednisone. I learned something really interesting recently from a friend of mine, Dr. Lauren Edelman. She's a veterinary internal medicine specialist, and she did a video about, is atypical Addison's real? There is chatter in the internal medicine community and research and developments that suggests that some of these atypical Addisonian dogs, while their aldosterone levels are not low enough that they have electrolyte imbalances, maybe when we diagnose the Addisons, these dogs often or sometimes they go on prednisone, they're on glucocorticoid management, and they feel better, but they don't feel 100%. They're still not great. And so it sounds like what these doctors and scientists have found is that some of these dogs do have lower than normal aldosterone levels. They're not low enough to cause these major electrolyte changes, but they're still too low. And you can actually test that, I learned from Dr. Edelman. You can do a blood aldosterone level before and after we do an ACTH stim, measure those levels, and they can be too low in atypical Addisonian dogs. And so the thought is that some of these dogs may actually benefit from DOCP injections, or things could maybe progress to needing those during treatment. So I found that really interesting. Definitely is making me think about my atypical Addisonian cases and something that we may want to monitor in those patients, especially if they're not feeling great once we get them on their daily dose of prednisone. So cool little pearl from my friend, Dr. Edelman. So that I'm going to I think I covered all the things I wanted to talk about. I'm going to close the book on the bulk of what we're talking about with Addison's. That's Addison's, hypoadrenocorticism. And next week, we're going to talk a little bit more about Addison's because I have a couple questions. But next week, we're going to talk about Cushing's. And Cushing's is sort of the opposite of Addison's. And it's also a very interesting disease. And I would say we diagnose definitely more Cushing's than we do Addison's. But I do have a couple of good questions. I did open up questions for our followers. Remember, you can always submit a question, a general question, or sometimes we'll tell you the upcoming topic and you can give us a question about the topic. The first question is from Dr. Jilly. I think maybe this is a vet. It's a great question. She said, do you recommend the low dose protocol for Addison's? It's been a game changer for us. So what's she talking about? The low dose protocol, I think what she's talking about is there's a paper that came out of, I believe it's Michigan State University, their veterinary medical center, that the sort of established dose of DOCP that we've been giving to our patients for a long time, which is 2.2 mg per kg, is maybe higher than it has to be. So they proposed that a lower dose of DOCP could be as effective, which is a really interesting thought. And one of the reasons they did this study was because of the sheer cost of DOCP injections. So if you if you have a large breed dog with Addison's, you are very well aware of this. But DOCP is not cheap. It can be very expensive. So in this write-up about this paper, they talked about they estimated the lifetime cost of Zycortal, one type of DOCP injections for a Great Dane. Now, this is a massive dog. So this is like worst case scenario. But they did lifetime costs for Zycortal for a Great Dane. They calculated this about 5 years. So they're anticipating 5 years after diagnosis because of typical Great Dane lifespan. $15,585 would be the lifetime cost of Zycortal for this big dog. That's significant. And so this was a big motivation for the study, which I love because I'm very passionate about spectrum of care. I think it's really important to consider these things because, there are definitely situations where patients get diagnosed with Addison's and owners are left with this decision, and sometimes they have to choose euthanasia because, one, the cost to stabilize their patient in crisis is overwhelming, and two, they realize that the lifelong cost of this is going to be so high. So this is very cool. The low-dose protocol is half of the traditional dose of DOCP. My understanding is I've not tried this. It's something I'm now going to consider, but it's the standard timing is my understanding. So 25 to 28 days, these dogs are going to get a DOCP injection, but it's going to be half the dose of what we traditionally do. And this is a good paper if you want to read it. It's published, but basically there are some side effects from DOCP. So those side effects go down obviously on a lower dose. And the thought is that it's going to be as effective at this lower dose. So that's the low dose protocol. I know there are several vets that use it, and I think that's why she's saying it's been a game changer for us. So in their practice, I'm assuming they're using that lower dose of DOCP. And I don't actually have a lot of Addisonian patients right now, but it's something I'm definitely considering. So thank you, Dr. Jilly. That was a great question. I'm going to take one more question. The second question is from Rochelle Olstad. And she said, how can a pet be diagnosed Cushingoid, but then have an Addisonian crisis? So remember Cushing's, Cushingoid dogs. That's what we're going to talk about next week. It's kind of the opposite of Addison's. It's an adrenal gland problem. Their cortisol levels are actually too high. And I told you that Addison's happens from an immune-mediated process, and that is what most Addison's is caused by. However, there are some situations where dogs can become Addisonian for other rarer reasons, and one of those is a dog who's being treated for Cushing's. The medication that's treating their Cushing's can actually make their cortisol get too low, and they become Addisonian. And their aldosterone. So that is what can happen if a Cushingoid dog is on too high of a dose, which is a great reminder why it's so important to do follow-up diagnostics that your vet recommends, because lots of medications that we put dogs on, we want to follow up with blood work after we start the medication to make sure it's not too high or too low of a dose. Great questions. Oh, other reasons for Addison's that are not the typical immune-mediated process. Dogs can have injury to their adrenal gland that causes this, Addison's, and there are some rare types of cancer in the adrenal gland that can cause Addison's and granulomatous disease. So there can be abnormal tissue that invades the normal adrenal tissue, and so it doesn't produce the hormones like it should. Thank you, Rochelle, for the question. Okay. I truly hope that this has been helpful. I hope it makes sense. Addison's is complicated. It was complicated and confusing for me to learn when I was in vet school. And it's always perplexing when we think we may have it in a patient. So I hope this helps. If you have a dog with Addison's, I hope this has helped you understand better what's going on with your dog and why, what has happened. And I hope that I don't wish this for you, but if you find yourself in the future with a dog with Addison's, I hope that you can remember some of this and feel a little bit better about what's going on. Okay, come back next week. We're going to talk about Cushing's, the opposite of Addison's, and be sure you can send me questions about Cushing's between now in our next episode. So this has been another episode of the Dr. Molly Says podcast. Thanks for hanging out. Come back next week. We're going to talk about Cushing's. You can find us at Dr. Molly Says Pod or me at Dr. Molly Says on all of your social media platforms. Be sure to rate us and download this episode wherever you listen to podcasts. Follow us, subscribe on YouTube where you can watch this every week. And you can always send me a DM or click the link in our bio to submit a question for our Burning Question segment. I'll see you next week. Thanks for joining us on the Dr. Molly Says podcast.